Hi, I'm Courtney Sheehan, one of the senior program directors here at CHR. I'm a licensed professional counselor and one of the leaders here for integrated care at CHR.
Hi, I'm Bill Behan. I'm the director of nursing here at CHR.
So Bill, can you talk a little bit about why tobacco and nicotine and vaping use is such a problem with individuals with mental health and substance abuse disorders?
I sure can. I think that the two things that I would like people to really know most is that more people with significant and persistent mental illness and substance use disorders use tobacco. Okay, and because of that fact, the other fact that we know is that more people with SPMI and substance use disorders are suffering the long-term effects of tobacco use and are dying younger.
So maybe it would be helpful if I can talk a little bit about the impact of nicotine use on mental health. So what we know about nicotine use and nicotine in general, that it's a highly addictive substance, and we know that it impacts the areas of the brain similar to other substances of abuse. So when somebody is trying to quit other substances of abuse and continues to use nicotine, they're at a higher risk of relapse. And we're really trying to get that message out that folks that do decide to quit nicotine use early in recovery do better in their overall recovery. Up to 25% better experience and success with longer term recovery quitting nicotine use early.
So wow, so the research really shows that treating the whole addiction is more successful than treating a given substance of addiction.
Mm-hmm. Yeah, and it really represents a change in our training, right? So it's not uncommon for behavioral health professionals to not have had any prior training or encouragement to tackle tobacco use early in recovery. We now have some exciting research that allows us to shift our approach a bit and help the folks we care for have stronger recoveries and a more comfortable experience with it. We know that individuals that decide to quit nicotine use early in recovery, who have layers of support like a primary care physician, mental health and substance abuse treatment, and who use two forms of nicotine replacement therapy, like a lozenge or a patch or a gum, have a up to 4 times greater chance of quitting smoking, which is really exciting.
And we know that the individuals we serve here at CHR want to quit smoking at the same rates as the general population. And we also know from the research that they absolutely can quit.
Yeah, that is exciting news to get out. Can you talk a little bit about some of the health conditions that smoking causes in individuals that smoke?
Sure. So smoking, as we all already know, is the major contributor to lung cancer and obstructive pulmonary diseases and those issues that affect our lungs. But it also contributes to things like high blood pressure and other vascular health issues as well.
So I think it's important to talk a little bit about some of the options that staff have here at CHR to help individuals address and think about their nicotine use. So one of the things that comes to mind is a 3-step process, which is ask, advise, and refer. So we encourage people to start the conversation. Ask, are you vaping? Are you chewing? Are you smoking? And advise, sharing the information that we're talking about today, that the impact on someone's health, the impact on their mental health, the impact on their recovery, and then referring. We have a lot of great options for folks that want to look at their relationship with nicotine, and that includes things like talking to their provider about medication-assisted treatment, or MAT, nicotine replacement therapy options, getting connected, making a referral to our wellness groups, and that could be either smoking cessation or nutrition and exercise groups. So those are some things that people can do.
Absolutely. So if you want to know more, here are some great links for more information on tobacco cessation.